Before you go home with your child, you're going to learn several things specific to spina bifida, and we'll make sure that you're very comfortable with the care that you will need to provide. Some of the things are the management of your child's probable neurogenic bowel and bladder, how we manage that, how you will manage it with clean intermittent catheterization. We'll also teach you signs of constipation. Other things will be exercises that the physical therapist will teach you in the hospital. We'll make sure that you're comfortable with that. We'll also do a lot of teaching around skin care, because most children with spina bifida have some impairment of their sensation in their lower extremities, and so we'll talk a lot about that. Also, if your child has surgical incisions from either the back closure or from a VP-shunt, you'll be taught the precautions and how to manage those things. You'll also learn about latex allergy, because there's a high incidence of it in children with spina bifida, though children aren't born with latex allergy. But we will teach you how to put precautions in place that will make you feel comfortable and make your child safe. Several things that your child may need when they're discharged home and as they grow. Medications are sometimes used in management of their neurogenic bowel and bladder. Those would be prescribed by our physicians in a pharmacy close to your home. Other things that children may need as they grow are sometimes they'll need orthotics or braces on their legs. Depending on the level of the defect, some of our children will need adaptive equipment to help with bathing, toileting. Some children will need assistive devices for walking, and some need wheelchairs. It can be a little bit tricky after you take your child home, because you'll be managing their bladder most likely with clean intermittent catheterization, which puts them at a slightly higher risk of urinary tract infections. We may be following your child for hydrocephalus, or if your child has a shunt for hydrocephalus, we will teach you the signs and symptoms of shunt malfunction or shunt failure. And a lot of those symptoms are very similar to other symptoms, such as fever, irritability, sleepiness. So it can be a little bit tricky for new parents to figure out what is just something that's related to childhood illnesses or baby illnesses and what can be related to spina bifida. But we'll specifically go over all those signs and symptoms and things that you should be more aware of, and how to contact your primary care physician or our clinic if you're worried.